Risk of cancer in 10 to 19 millimeter endoscopically detected colorectal lesions. Introduction. Increasing colorectal polyp size has been consistently associated with a higher risk of invasive colorectal cancer. Recent studies have focused on the prevalence of cancer in polyps less than 10 millimeters in size and have identified a lower risk of invasive cancer compared with earlier studies. Some recent studies have investigated this issue to determine the feasibility of a resect and discard strategy for diminutive polyps, as the prevalence of cancer in diminutive and small polyps is a determinant of the appropriateness of a resect and discard paradigm. Declining rates of cancer in small and diminutive polyps may reflect improved optics in colonoscopes that expose large numbers of low-volume, flat adenomas with a much lower risk of cancer compared with the larger volume polyps detectable with lower resolution and fiber optic instruments used in older studies. The anticipated risk of cancer in polyps greater than or equal to 10 millimeters is also of importance to endoscopists, as polyps with a greater risk of cancer are optimally resected en bloc. Thus, the risk of cancer may affect the resection approach. Furthermore, resected polyps with a higher cancer risk should be handled properly by the endoscopist and pathologist so as to ensure proper orientation and optimal pathological assessment. Several studies have focused on cancer risk in colorectal polyps greater than or equal to 20 millimeters. Although some studies have reported the risk of cancer in polyps 10 to 19 millimeters in size, the authors considered that it would be useful to update the prevalence of cancer in polyps in this size range, as polyps of this size are common, and this issue has not been extensively studied using modern colonoscopes. The authors now report the largest study to address this issue. Background. Recent data indicate that the risk of cancer in colorectal lesions less than 10 millimeters is lower than previously reported, possibly reflecting improved detection of flat, low-volume lesions with a low risk of cancer. Few studies have examined the prevalence of cancer in colorectal lesions 10 to 19 millimeters in size. Methods. Parsa et al. Reviewed a prospectively collected database of all colorectal lesions removed at a single endoscopy center in order to identify lesions of 10 to 19 millimeters in size and review their histology. Lesions greater than or equal to 20 millimeters were evaluated as a control group. The authors reviewed photographs of cancerous lesions to determine the frequency of endoscopic features of cancer. Results. A total of 5,093 lesions greater than or equal to 10 millimeters were removed from 4,020 patients, mean age 63.2 years, 34.4% female. Among 3,068 lesions 10 to 19 millimeters in size, 28, 0.9%, had adenocarcinoma, including 1.2% of conventional adenomas and 0.3% of serrated class lesions. These rates were lower than the 6.9% and 2.0% rates of cancer found in conventional adenomatous lesions and serrated lesions greater than or equal to 20 millimeters, respectively. Cancer was suggested by endoscopic features in 52.0% of malignancies 10 to 19 millimeters in size, compared with 79.2% of lesions greater than or equal to 20 millimeters. Conclusions. The prevalence of cancer in 10 to 19 millimeter colorectal lesions was much lower than previously reported. The cancer risk was higher in conventional adenomas than in serrated lesions. Cancer was endoscopically evident prior to resection in slightly more than half of colorectal lesions 10 to 19 millimeters in size.